Okay, so we have seen the factors in the last factor this thing class. So now last video. So now we will see what is the instrument that is used in measuring the blood pressure. So the instrument that is used is the Sphygmomanometer. So the standard instrument used to measure the blood pressure is called Sphygmomanometer, and there are two types of pressure manometer. Okay, you have one mercury and one aneroid. So what we have in our labs and what we will be using for the patients in the hospital is the mercury type, that is a sphygmomanometer. The other type is aneroid one. Okay, so both give accurate readings when they are functioning properly. Experiments show that the mercury manometers are accurate and reliable than the aneroid manometers. So you know what, the sphygmomanometer only is most reliable. Only the sphygmomanometer gives the correct reading. We have various types of measuring blood pressure. Like you can see in the hospital when you go, for critical patients we also have arterial blood pressure monitoring. Okay, more than that, so sometimes we don't know if line is proper or not. So in any case of doubt, immediately the doctors themselves will say, sister or brother, you please check the blood pressure manually. So much, what, sphygmomanometer only is more effective than any kind of other types of blood pressure equipment. Okay, so to be accurate, the mercury column should have no zero error. The mercury should rest at zero before pressure is applied, and it should fall freely as cuff pressure is released. So what are they talking? So even before you see the rise of the mercury, so mercury is there, right? So even before you see the mercury level rising, always before you check, the mercury should be at the level of 0. It should be at the resting level. Okay, then we know that the machine is appropriately working. Then you have the use of proper size cuff necessary to get an accurate reading. So basically when you see a sphygmomanometer, it is like a box type, right? It is like this, and you can close it. So when you open the sphygmomanometer, so on the stand, you will see that there is manometer reading. Okay, so you'll have 40, 50, 60, 70, 80, 90. It will be like this horizontal, vertically. Okay, like this, the mercury will be there, vertical tubing, and then on the both side you will have the readings. Okay, and now what happens is, so when you check, the mercury should be at the 0 level, and there is a tubing that is connected to the sphygmomanometer. That tubing will be connected with another tubing to a cuff. Okay, so there is a cuff, so that cuff will be connected. So cuff will be tied on the patient's arm. You have to tie the cuff on the patient arm. So that cuff should also be checked. Sometimes when you tie the cuff around the patient's arm, upper arm, what happens is, when you inflate the cuff, when you are pushing air into the cuff, sometimes it will become so big and the air will not be released. So we have to check whether the mercury is at 0 level. Then you have to deflate, inflate, and see. Okay, inflation is pumping up air, deflating is releasing the knob so that the air will come out. Okay, and then you have, so the use of proper size cuff also should be done, because for adults we have big cuff, for pediatrics we have small cuff. Okay, for infants again it is very small cuff that is used, so accordingly we have to use. And then the cuff is too narrow or not overlapping, the readings will be false. It should be tied properly. It should not be too tight, too loose, and you should not overlap it. Correctly you have to tie it. A cuff has too wide for the extremity gives a low reading. The width of the cuff bladder should be 20% greater than the diameter. So just remember that the cuff should be normal and it should not be too wide. Wide means very big. Okay, big cuff, it will actually not give the correct reading. And then should be 20% greater than the diameter of the extremity on which it will be used. It should be long enough. It should be long enough in circle the inside the extremity. Okay, so it should be long enough Okay, so where you can tie, it should not overlap, the width should not be too big. Okay, it should be of the correct size. So all these points you have to remember. Next, when we are going to check the blood pressure of the patient, what is the preliminary assessment that we will be doing for the patient? First, you have to identify the client to whom you are going to do. Check the diagnosis, reason for checking. So every patient we will be checking the vital signs once when they come in. So patients with hypertension, frequently we will have to check. So check according to the order, find out why, every now and then you have to check for the patient. And then for taking BP schedule, frequency of obtaining BP, previous measurement and range of blood pressure. So what was the previous measurement the patient had? What was the previous time blood pressure? When they checked last time, what was the blood pressure, that we have to know. Then physical and mental state of the client. If somebody is anxious, worried, or they are crying, or they are very happy, excited, or they are having severe pain, then immediately we should not record the blood pressure because it will give us false reading. Okay, so taking on a client who is angry, anxious, or in pain, or crying child, okay, we cannot take because it will give false blood pressure reading. Then assess the arm on which the blood pressure can be taken. Where are you going to take? Which hand you are going to take, that you have to assess. Usually they say checking on the left side is good because it is closer to the heart. Okay, so preferably they always say left side. Okay, now we will see contraindication, in which all condition we will not check blood pressure in the arm. So first one is the arm as an intravenous infusion on it. Now as I told you, left side, it's very good for measuring blood pressure, but there is a IV line. Okay, then you cannot check the blood pressure on the left side. On the right side you should go. Say now if the patient is having both side line, then you have to check it in the lower arm. Okay, so either remember the pulse arteries that we studied. What are those? Popliteal artery, popliteal fossa behind, right? So you have to tie the cuff on the thigh and you have to keep the stethoscope on the popliteal artery to check the blood pressure, or above the ankle. There are again two arteries running, dorsalis pedis and posterior tibial artery. So you can tie the cuff above the ankle and then you can use these two arteries to check the blood pressure. Okay, then if the arm is injured or diseased, there is a fracture, okay, where the patient cannot move the hand or restricted movement is there, then we do not check. The arm as a shunt or fistula for renal dialysis. Okay, so patients who are undergoing dialysis, here at the wrist they will make a fistula where they will be joining an artery. Okay, artery and a vein will be connected and you will see that there is a big, it will be like a big pump. Okay, so it will be like a big bump there, so like a swollen thing. So immediately you can know, you should ask the patient, what is this? Then they will say this is for dialysis. Okay, anyway by history we will know that if the patient is on dialysis, so you are in a OPD when the patient comes. So once when you see that itself, you should ask the patient, what is this? When they say this is fistula or I am a dialysis patient, immediately you should not check in that arm. It can be either on right hand or left hand. So in that hand we do not check. And on the same side of the body where a female patient had a radical mastectomy. So females, if they have underwent, what is mastectomy? Removal of the breast. So they had cancer the right side or left side. Sometimes some patients will have on both sides, so because of which they have removed the breast. Okay, so in that case mastectomy, removal of the breast. So whichever one side, if it is removed, we will not check in that side. If another side, if they have not removed, you can check. But if it is on both sides, then we will not check in the hands, then you have to check it in the leg. Okay, so now next is the preparation of the article. So what all is required? You have to take a tray containing sphygmomanometer, stethoscope, and then a bowl containing 2 cotton balls. Paper bag should be there. Okay, so sphygmomanometer is an instrument. So before bringing to the patient side, check if the mercury is functioning, tighten the bulb, pump in air and see if the mercury is rising. Then check with the cuff size, whether you are going to check for infant, children, or adult. According to the age size, you have to keep the cuff size and keep it ready. Then see if stethoscope is working. What are the parts of stethoscope? earpiece, binaurals, tubing, bell and diaphragm. Okay, just tap and see if you can hear the sound, and then bowl with cotton. Why? Because you have to clean the earpiece and then use it on the ears. Okay, you'll have to place it. So used one, you can put it into the paper bag. So these are the articles that is required. Then how do you prepare the patient for blood pressure? So explain the procedure to the client to gain the confidence and cooperation of the patient. So you can tell them taking blood pressure is not painful, but it might lead to little discomfort. Just tell them that you are going to check the blood pressure. Place the client in a comfortable position, either lying down with the arm resting on the bed or sitting with the arm supported on the table at the heart level. Ensure acute reading. So if you want, you can give the patient sitting position, but always lying down position is good. Sitting position, again the patient will have to hold the hand like this or like this. They have to stretch. It will cause pain to the patient. When they are lying down, it is easy for us to check the blood pressure of the patient. Then client should rest at least 5 to 10 minutes prior taking the blood pressure. So that we know, right? So what happens, you have to check the blood pressure after giving them 5 to 10 minutes. Make sure that the patient is calm, is not anxious, is not worried, is not excited, and then you take the blood pressure of the patient. Aftercare of the client and the articles. So after taking blood pressure, what will you do? You have to remove the cuff by rolling it and replace it in the box. In the sphygmomanometer, down it is, there is a place where you have to roll and keep a cuff. So roll it, keep it there, then assist the client to cover the arm. So if you have removed the shirt, or if the patient sheet has been removed up, or cover sheet, make sure that you give comfortable position and cover the patient. Okay, and then take the apparatus to the duty room and keep it safely in the cupboard. So make sure that whenever you take the blood pressure, you should always keep in your hand like this. Okay, you have to keep it, and then you have to take the blood pressure instrument and keep it in the cupboard. Keep it safely. Wash hands, then record the reading immediately with the date and time. Record it and record what was the blood pressure of the patient. Okay, so we will be seeing in the next video. I'll just tell you how we have to check the blood pressure. Okay, so there are many types also of checking of blood pressure. So we will do that.